Hi, thank you for watching Derek Jones Facial Plastic Surgery Show. I'm your host, Andrea Housen. I'm also the practice coordinator for Dr. Derek Jones. I'm here with him right now. He is double board certified, and we actually are here at the new Blab Studios at Belmont and DeVillers, and they created this virtual set for us. Dr. Jones, how are you?
I'm doing great. Yeah, this is a lot of fun to be here, and we're in the first few days. We're some of the initial people to film in this studio, which is really exciting. I know it looks like we're in the middle of my operating room here, but we're not.
Yeah, it's the virtual set that Blab created for us. They came to the Ambulatory Surgery Center and filmed the OR.
Yeah.
And this is where all the action happens with Dr. Jones is doing surgery.
That's exactly right.
And right here, this table behind Dr. Jones is, I've been there a few times.
Right.
And we're going to talk about rhinoplasty today.
That's right.
It's one of the more challenging procedures that you do.
Yeah, it certainly is. So we're going to talk a little bit about that. But before we get started, let's talk a little bit about where we're going to be and what we're going to be doing over the next couple months or 3 months or so. So if we can go to our PowerPoint slides, we'll talk a little bit about where we're going to be, what we're going to be doing. So save the dates for these upcoming events. Here we go. We'll talk a little bit about our Gulf Breeze office, which now we have been in for almost 6 years.
Oh, wow.
It's crazy that we have been in that office that long. But it's been great. Patients love that office.
We love it too.
As I say, yeah, we love it. But I'm there on Fridays. So, come see us on a Friday morning. We will be there, on Fridays. And, like I said, it's a great place to see patients, and we really enjoy it. We'll show a little bit about it. There's our frontage there, the Hearing Center, Ear, Nose, and Throat Medical Center Clinic. And so we have our entire ear, nose, and throat department that goes there with myself, my partner, Dr. Holt, goes there 1 day a week, and then my nurse practitioner, Jessica, and then also his PA, Stephen Marshall. Yeah, so you'll know the signs on the doors. You can see my logo at the bottom there, then the Hearing Center and Ear, Nose, and Throat. You'll know you're in the right place. 207 Gulf Breeze Parkway, right next door to Baskin Robbins on one side and Poke Bowl on the other. This is our front desk that we have, and you will see Caitlin, who does such a fantastic job for us in Gulf Breeze, at the front desk, and this is our waiting room there. But people love that office. It's easy to get to. People from downtown will come across the bridge and or East Hill or Navarre. Yeah, Pensacola Beach and Navarre.
We see a lot of people from Panama City and Crestview.
We do. We really do. From all over. There's a big need. So, and so we will be there on Fridays. Reach out to us and come see us. Also, we will be in PACE. We have a new partner in PACE, or relatively new this year anyway, 2026, which is on Highway 90. Pittenhouse
Salon and Spa.
Yeah, they are fantastic. I really like working with them. Super nice people. And it's a great facility that we're going to show you a little bit of. There you can see. You can see their signage that they have. It's really good.
We're going to be there on the 24th. Of June from 9 to noon.
Yeah.
That's the spa entrance that you will, there's two entrances. There's the front that faces Highway 90 and then the side entrance, which is where you would come to see us. But you can always give me a call at 484-FACE, 850-484-3223 to get booked. There's still a few spots left for the 24th of this month.
Yeah, June 24th. Again, come in the side entrance there. This is one of the places in the spa, and then you can see this is actually their.
It's a beautiful space.
Yeah, that's their salon for hair, and then this is our space in the back there where we do our injections, and we can do consultations. We can do all of those things. So come see us at the end of June. We will be there once a quarter, so we should be back in September.
Yes.
And we will keep people posted of where we're going to be and when we're going to be there. be in East Hill at Chastain's, back at Chastain's, which we've been to for many years. And I love working with Mary Chastain and Deborah Ward and all the wonderful people there. July 22nd.
Heart of East Hill and 12th Avenue.
Yeah.
We love going there. That we'll be doing Botox, Dysport, Xeomin, Juvederm, Restylane. We can even do consultations. You can always call their number at 435-9935, or you can always get in touch with me, 484-FACE.
484-3223. That's going to be right after Blue Angels. The Blue Angels weekend is the weekend before that. So exciting times. And then downtown at Result, which is on Jackson and Alkanese. Yep, Alkanese and Jackson on the corner, 9 to noon. Again, August 26th. And again, we go to each of these places once a quarter. So we'll be rotating through, and we will keep everybody posted as to where we're going to be when, but you can always call us and ask us. Always check us out.
Facebook.
Follow us on the Facebook, of course.
I try not to inundate the feed, but I always put on Facebook where we're going to be, specials.
Yeah.
And I also do an email blast, so you can always call me and I can get you on the email list.
Yeah. So let's talk a little bit about nasal surgery and rhinoplasty surgical solutions. There actually are some non-surgical solutions for rhinoplasty, and sometimes that's the best option depending on what the problem is and everything. We will do fillers into the nose, which can work very, very well. So, it's always worth coming and getting a consultation and talking about what your concerns are. Rhinoplasty is one of the many things I do with the nose. Basically, I focus on any problems with the nose, essentially, whether it be reconstruction after skin cancer removal, functional surgery to recreate the nasal airflow and work on stuffiness and problems like that, sinus surgery, all of those things. So if you have a problem with your nose and you come see me, you're in the right place. And particularly if you are concerned about the appearance of your nose. But again, we focus on any sort of problem with the nose, essentially, which is not, everybody doesn't do that. So,
well, that's true. We get a lot of referrals from other ENTs.
We do.
And that's something important to mention. You are double board certified in otolaryngology and facial plastics. So you can improve the function of the nose and, of course, make it look beautiful.
Make it look beautiful. And I have had that situation where someone needs sinus surgery. They need would like to have cosmetic surgery done on the nose. And they've been to even like academic institutions, and those places say, well, we'll have one surgeon do your sinus surgery and one surgeon do your rhinoplasty or do your other surgery. One person even was going to have two separate surgeries. They couldn't even have them done at the same time. And so, that is a skill set that I have developed, and I can do both of those operations at the same time. If you have sinus problems, if you want to have cosmetic surgery, if you need nasal reconstruction for nasal collapse, things like that, nasal trauma in the past that needs to be fixed, all of those things we can address. So.
Right, and it's rare that you just do a rhinoplasty without doing a septoplasty.
Yeah, straighten the septum, trim the turbinate some. Sometimes, again, look at the sinuses, see whether or not the sinuses need to be addressed as well. So all of those things we can do. We're going to be showing you a lot of rhinoplasty patients and one or two patients that have had some other things done as well. But it is good to be able to do all those things for patients at the same time.
And that's what the consultation's all about. We bring you in to talk about your nose. Most likely, Dr. Jones would order a CT scan just to make sure there's no sinus issue.
Yeah, or other nasal anatomy. A lot of people have had trauma. A lot of people have had prior surgery, things like that. And so it's not uncommon to get a CT scan. Sometimes we'll even look at in the nose with a scope or do things like that to get a better idea of kind of where we're starting and what we need to address. And then talk about, kind of what we need to do to get you to where you would need to be. And sometimes it is medical treatment, and sometimes it, like I said, injections if we're addressing certain cosmetic issues with the nose. But if it comes to surgery, then we're prepared to do that. Yeah. So we have a couple minutes for the break, and I'm going to show at least 1 or 2 pictures just to get people to come back after the break here. So, so let's just go through, and this is a patient who was primarily concerned about the appearance of her nose. And on the front, it's a little harder to see the before picture versus the after picture, but she just had what we call dorsal convexity, so a hump on the bridge of the nose. The tip of her nose was the cartilages were really prominent, and there was a cleft between the cartilages, and what we call a bulbous tip, kind of fullness. Her nose was over projected. It was sticking out too much. So there's a lot of issues that we dealt with her nose, and corrected each one of those things. I mean, kind of went through the processes of working on correcting those things, and ended up with, I think, a really nice, natural looking result that takes the emphasis off of her nose and puts it onto her face and her eyes, and in particular. The eyes and smile are the focal parts of the face, and so anything we can do to improve those areas or make those areas look better is really a positive thing. And the nose detracts from the eyes in particular, because it, if you notice a nose, it's usually not for a good reason.
Right. No one ever says you have a beautiful nose. It looks like we're going to a break. Stay tuned. Many who consider facial plastic surgery are concerned their results will look unnatural. But with over 20 years of serving the Pensacola community, his thousands of satisfied patients have made Dr. Derek Jones a trusted reconstructive and facial plastic surgeon known for industry-leading results that look natural. Call 850-484-FACE to schedule a consultation at one of our locations in Pensacola and Gulf Breeze.
I'm Dr. Derek Jones. Trust your face to a facial plastic surgeon.
Imagine a new kind of hearing experience that lets you hear more of everything. ReSound Lynx, the world's smartest hearing aid.
It's baseball season. From heart-stopping plays to legendary victories, this is baseball at its finest. Grab your seat, bring your energy, and witness greatness live. Don't just watch it, feel it. The Pensacola Blue Wahoos are back, and you can watch Pensacola Blue Wahoos home games live on Fridays and Saturdays, only on Blab TV. Love the Blue Wahoos but can't watch? Get your tickets now.
Fostering a pet for a friend or neighbor can keep families together. Learn more at petsandpeopletogether.org.
I'm Dr. Mark Lees with Mark Lees Skincare Incorporated. I've been in the business for 4 decades. I've seen tons of Dr. Jones work. Dr. Jones actually worked on a really good friend of mine, took 15 years off his face. It was just amazing. So it was really, today is the day. I got to call Dr. Jones. My only regret in having my work done was the fact that I didn't have it done about 3 years earlier.
I'm Dr. Derek Jones. Trust your face to a facial plastic surgeon.
Welcome back to Derek Jones Facial Plastic Surgery. So in case you missed it, we were talking about rhinoplasty. I'm here with Dr. Derek Jones. He's double board certified in otolaryngology and facial plastic and reconstructive surgery. Dr. Jones, tell me why rhinoplasty is so challenging.
So the main reasons that rhinoplasty is so challenging is that the nose is right in the middle of the face. So it's not like an ear or something like that where it's not quite as noticeable to people. So it's right in the middle of the face. Small changes are noticeable on the nose. So we call it a surgery of millimeters. So you can notice a 1 to 2 millimeter difference or depression or deviation or something. You can notice small differences in the nose. They're all not critical, but they are noticeable. And so it really, there's an exactness to it that really needs to be done in order to get the best result. And then everything is interrelated. So when we change the bridge of the nose, it affects the tip of the nose. When we, make changes to the middle part of the nose, it can affect the tip. Or, we do work on the septum, that can affect the bridge of the nose or the tip of the nose. And so everything is really interrelated. And all those things have to be taken into account all the time within a millimeter or two, right in the middle of the face. So that's why it gets, it's challenging, and there's a lot of, preciseness that it requires, and takes time. It takes time to really develop as a good rhinoplasty surgeon. I know I've been to meetings where they say, you're really hard to be a good rhinoplasty surgeon before you're in your 40s.
Yeah.
So
had a lot of experience.
I have had I'm not in my 40s, but I have I definitely have the experience as well in terms of the, being an experienced rhinoplasty surgeon. And I feel like, we get good results. I mean, we really feel good about the results we can get working on the nose, but it's not easy. And I tell people, if you go to someone and they are kind of nonchalant about it, or they say it's, simple, and kind of make it, sound real easy or something like that, I don't know. I wonder about that, because I don't think it's really that easy for anybody. There are some world-renowned people that are very, very skilled in that kind of thing, but it's not an easy operation.
Right, and you do get a CT scan. It's important to know what you're getting into before you open the nose, because
I think
like
that a lot of times we do, and we want to make sure that we don't do surgery and then realize later on maybe there was something we might have wanted to address or things like that. So, we like to get some information before doing surgery, in particular with people who've had surgery before, or people that have had trauma or things like that, because the anatomy is not completely normal. And it depends on symptoms and so forth, but we really, work to get a good plan for each person.
We see a lot of folks that need functional septonasal reconstruction. Right. And versus a rhinoplasty, there is a difference.
Right. And I think, when we talk about rhinoplasty, there are really two types of rhinoplasty. Rhinoplasty are a lot of the techniques themselves. So the, moving the cartilages around, or sometimes re-breaking the bones, or things like that. And a lot of that is required when we do reconstruction. So if people have had trauma, if they have difficulty breathing through their nose, that kind of thing, we need to do procedures that are called a rhinoplasty, and there are codes for rhinoplasty, just like there are codes for all the procedures that we do. But a cosmetic rhinoplasty is a little bit different in that the purpose of it is to make the nose look better. The purpose of a functional rhinoplasty and reconstructive surgery is to make the nose work better, also look better, but not to the same. It's not the same as a cosmetic rhinoplasty, because a cosmetic rhinoplasty may make the nose look smaller. You don't necessarily have to make the nose look smaller, or you don't have to make the nose smaller in order to work better. You don't have to do tip refinement, or take the bridge of the nose down, or make those types of changes in order to change the function of the nose. So, reconstructive surgeries try to give you a good functional nose that is basically your nose, the nose that you had. A cosmetic rhinoplasty is changing the appearance of your nose to make it look more like the standards that look good to most people. And there are certain things that we look at that make a nose look good to most people. So that's the difference. And I think people come in and they think that, I'm going to have a rhinoplasty, and we're going to change my nose to make it look like I've always wanted it to look. Those things can be done, but that's a cosmetic procedure. Those are cosmetic procedures, and there's differences. I mean, there's a different standard. There are some additional associated costs and things like that. So a lot of that goes into the education that we work with patients on before doing surgery.
Yeah, we talk about that at the consult, and I'll get an estimate through the insurance to see what insurance will cover as far as the functional nasal surgery.
Right, versus the cosmetic surgery, which is going to, again, change the appearance of the nose in a different way than, say the reconstructive, which is more restoring your nose rather than changing your nose to look like, smaller or
Right.
better defined or things like that. So, but let's show some pictures. Let's show some more pictures. I have some more pictures on our my laptop here. So this is a patient that came in and felt that her nose was too big for her face, and as is not uncommonly the case, the front view doesn't tell the whole story. Although I do think her nose looks some better on the front, looks a little straighter and everything. This is the view that we are most viewed in. I mean, this is the view that most people see us in this view day to day. It's not, and it helps us. It's not a view that we, use to make changes with or things like that. Like the profile, we're going to look at taking the hump down, rotating up the tip, bringing the tip back in toward the face, and those sorts of things is how we visualize that. But really, that 3/4 view is how we're most often viewed. But you can see what we've done with her nose. Her nose was, she had what we call a dorsal convexity, so there was a hump, stuck out a little bit too much, and was under rotated, so like it drooped a little bit. So rotating up the tip, bringing in the bridge of the nose, and having it all work together in harmony to really fit her face much better. And we'll show a couple more views of her, and then we're gonna go through some more of these pictures. Again, the profile is just a more standard, the way that making her nose look the way she wanted it to look, but that's also, these are kind of accepted norms for the nose.
She had a septonasal reconstruction and a cosmetic
I
rhinoplasty.
think she had some functional work done as well, which is not uncommon too. This is a patient who just felt like her nose was too big for her face, and some nasal stuffiness too, which is not uncommon. But just felt like her nose was a little bit too big for her face, and it was a little bit too big for her face. It was, you can tell in the profile, again, a kind of a convexity. So a hump on the bridge of the nose just stuck out too far, we call over projected. And again, just was too big for her. So, reducing all that down, doing some refinement in the tip, and just making it fit her face so that, most people wouldn't think about her nose, or maybe think it does look really good. I don't know. This is a patient who had some trauma.
Yeah, she fell off a bike, I think.
Fell off a bike, or I thought it was a cheerleading accident. I can't remember which, but anyway, she had some trauma, and so and she had some breathing problems, and also felt that her nose was a little bit too big. And so you can especially see on the profile how we took the hump down, did a little bit of tip rotation, and again, just made her nose fit her face better. You can see the hump there that is...
and she was 17 when you did the surgery.
She was young. That's, for women, for women and girls, about 15 to 16 is when the nose fully is grown. In boys, it's more about 17, 18 years old. So boys' faces grow a little bit later than girls. Again, the hump is taken down, the tip has better definition and rotation, and just looks better. You can see the base view of the nose, the tip is just not as bulbous and full. Another patient, she had actually had a rhinoplasty, and she couldn't breathe well through her nose, and we added structural support. And it's hard to see a big difference here. You're going to see more of a difference. See a little bit on that 3/4 view. On the profile, you can see how her nose was stuck out a little bit too much, brought her nose back in toward her face a bit. And then in particular on the base view here, you can see how her nose collapsed. That's her trying to breathe through her nose. Before this, her nostrils were so narrow,
Yeah.
she couldn't breathe through her nose. And adding structural support Her nostrils are a little bit wider, a little bit less, slit-like, and then she could breathe through her nose and they didn't collapse. Big difference for her. And then another patient who had some trauma, difficulty breathing through her nose. She had a little bit of a dorsal convexity or a hump in her nose. Wanted her nose turned up a little bit with a little bit more of a concavity rather than a convexity. And you can see how that was accomplished there. Again, tip rotation and refinement, taking down the bridge of the nose. And again, all these things are sort of changing as we do it. Most of these patients have come on our show,
Right.
Which is great.
Yeah. And we're thankful for that.
We sure are. And then you can see the results and how natural it looks and how it really fits her face and feminizes her face quite a bit as well. Right. This was about a year after. I think now it's even a little more refined. A year or two down the road, it's even more refined. This is before. She had a lot of collapse as well. And, we did change the shape of the base of her nose, but it doesn't collapse anymore. Like, she can breathe through her nose and it doesn't collapse, even though it's a little narrower and the tip is more defined and everything. It's not as full. She has a much better support and she can breathe through her nose. And I think that the picture's worth 1,000.
Yeah.
Just obviously very happy with the appearance of her nose now. So yeah, I think, rhinoplasty, it's a great operation. We see a lot of patients that need nasal surgery, but if you're having problems with your nose, you shouldn't really notice your nose, is what I tell patients. If you notice your nose, it's not for a good reason. Either you're having trouble breathing through your nose, there's too much drainage, doesn't look the way you want it to look, or a combination of things, and come and see us.
Yeah, we're wrapping it up. Thank you so much for watching. Good night.